Christchurch doctor is calling for more funding and support for Pacific Island families. Many of them at his clinic have complex health issues and they need extra support. Here's Marcus Gibbs.
The Antonios are your typical Pacific Island family. Their 4-bedroom house is home to 7 people, 5 children and their 2 parents. And at times it can be a very busy place.
Still noisy, yeah, but on the time now, the school time, scared. Quiet.
Pacific Islanders traditionally have big families and many are on low incomes, which means more people are sharing a home than the house was designed for.
We're always worried when we get near winter. There's not enough houses that can cater for the size of our families. So that's probably the main area of concern for us.
The doctors at Pacific Trust Canterbury are seeing many families with overcrowding at home. Overcrowding encourages the spread of diseases like meningococcal, tuberculosis and various skin infections. Sickness spreads easily through a big family.
You know, if you've got like 6 or more children who are between the ages of 6 to 18, you know, when winter comes and they're quite sick and you need to see the doctor, that costs a lot of money, especially when you're on low income. But with this service here, that caters for those types of families because it's free for those kids.
To counter this problem, a Pacific primary health facility has officially reopened in the CBD following major earthquake damage to the original building. The doctors and nurses are able to treat families suffering from the effects of overcrowding.
Amazing day. We've been waiting for this for the last 4 years.
The clinic is run by Pacific Trust Canterbury, the South Island's largest provider of Pacific primary health, social and community wraparound services.
A lot of our patients don't just come for GP services, but there are other raft of needs that they have that we have to look after.
One of the Trust's doctors is now calling for the government to provide further funding to be locked in to help at-risk Pacifica families.
This place is a very low-cost access practice, a VLCA, and that is heavily government funded, and we need that funding to be maintained, to be across successive governments. And for there to be that political will to support a growing sector of the community that is really struggling.
There are around 10,000 Pacifica families living in Christchurch, and as the rebuild continues, Tony's forecasting up to 2,000 extra families moving here for work within the next 2 years.
They've got large families and they will bring their families, so that's what we've got to be ready for.
The Antonios are grateful to have access to the clinic. It helps by providing transport and an interpreter to make sure the family gets the help they need.
Yeah, it's amazing. I love them.
Pacific Trust Canterbury runs on a budget of $4 to $5 million a year. 3 doctors and 3 nurses work at the new centre, and it's a busy place.
Because our patients will turn up with everybody, you know, they'll bring the whole family, and some will wait out here and some will be inside. But that's the Pacific way in which the family sticks together.
Before the earthquakes brought down the Worcester Street building, this clinic was seeing around 2,500 clients a year. The new building will cater for up to 5,000 patients and allows Pacific Trust Canterbury to serve a growing population with complex needs.
They've got diabetes, obesity problems, health problems, mental health problems. There's also cases of domestic violence.
With the capacity to help thousands of families a year, this trust is confident they'll meet the demands of the city as the Pacifica population grows in Christchurch. Marcus Gibbs, CTV News.